San Diego 6 News in the morning. Your station for balanced news.
Well, did you know that every 3 minutes a woman is diagnosed with breast cancer? It is the leading cause of death for women between the ages of 25 and 59. And yet most women don't even know that they're at risk for the disease. Now, this morning here on San Diego 6, we're talking about a new technology that could help prevent breast cancer. Dr. Robert Byer is an OB-GYN with Women's Care Center. Is that right? And you are here with your patient. I'm sorry, what's your name?
Rosalia.
Rosalia. Now, Dr. Byer is here to talk to us about a new technology called Halo. This is Halo right here. I think first of all we want to talk about that October is Breast Cancer Awareness Month. So I think the most important question is who should get this and why?
Well, this is a non-invasive way for us to examine the risk for breast cancer. As you mentioned, breast cancer is a very common killer of women. 1 in 8 women in the United States will develop breast cancer in her lifetime. The overwhelming majority of those women do not have risk factors. In fact, 70% will have no identifiable risk factors at all. This is an examination that allows us to look at the cells within the breast tissue so that we can examine cells that are at risk for developing cancer before cancer actually takes place. It doesn't replace the mammogram, although a mammogram or any radiographic evaluation really evaluates cancer or a mass, whereas this finds masses that would develop 8 years before they could be detected. It's really recommended for women who are 25 years or older, which is much earlier than mammograms are recommended. Right. Mm-hmm. So it allows us to find breast cancer in women who are younger and in whom cancer is typically much more aggressive and life-threatening. It works much like a suction cup for breast pump, and it fits onto the woman's breast, and it is able to pull out the fluid that's within the ducts of the breast, because we know that the overwhelming majority of breast cancer begins in the ducts of the breast. By examining the fluid within the breast, we know those women who are at risk for future development of cancer. The reason to have it done is that, women who are at risk can then be proactive about their health. It uses the same technology or the same scientific principles as the pap smear is for the cervical cancer. And so it allows us to identify people who are at risk so that we can intervene earlier. Maybe it means they do have a mammogram earlier than is recommended, or they have genetic testing, or perhaps they even go so far as to have surgery to prevent breast cancer in the future.
But with breast cancer, I know that early detection is the key. Is that correct?
Absolutely. It's true with any cancer, but most importantly for breast cancer. By the time that we examine a breast, breast tissue is frequently difficult to assess by mammogram. Many women who have had their mammograms are called back, or they're told their exam isn't exactly perfect, or they weren't able to see things, or maybe there was a shadow that they didn't understand on the radiographic evaluation. So this allows us to have an earlier detection so that women who are at risk, which if they have atypia or atypical cells or dysplastic cells within their breast tissue, they have a 4 to 5 increased risk of developing breast cancer. So for those women, if there is a shadow or if a mammogram is not perfect, they may have a higher need for a more detailed evaluation.
Now, Rosalia, here's a question for you. You've had this done. Does it hurt? What does it feel like?
No, it's a very minimal discomfort. It's more like really like a breast pump. And it was only about 5 minutes. I think it took longer for the machine to warm up. And it was an alternative that I had. I still had the mammogram done, but last year, my first mammogram, they called me back. So this year I went ahead and did the mammogram, but this was another alternative that I had. And I like the fact that it can, tell you if you're possibly at risk. I do have 4 daughters, and I would definitely recommend this to my daughters because I have 3 that range from the age of 22 to 31. And since a mammogram generally isn't recommended till the age of 40, this would give women with that age, between 20 and 40, another alternative. So I would definitely recommend the Halo.
Now, this is something that is available here in San Diego. Is that correct, Dr. Byer?
It is. There are a few places in San Diego that have this available in their office. We have it available in our office in Encinitas. It's covered by insurance with regards to examining the actual cellular component, looking at the lab component. The actual procedure itself costs around $75 in our office just to cover the cost of the disposables. It's a 5-minute test. It's non-invasive. It simply suction cups that go in the breast, and it's performed by one of our nurses in our office.
All right. Thank you so much for joining
You're
us this
welcome.
morning,
Thank
Dr.
you.
Bider. Rosalia.
Thank you very much.
Thank you. And of course, as always, for more information on Halo, you can always log on to our website at san diego6.com and click on Hot Topics.